Wizards, it's Professor Ferlamin. I am your host today who will play an important role as an agent of public health to transmit knowledge as you navigate through the field of epidemiology. It is sort of a bird's eye view of the work environment of an epidemiologist. In this video, I will provide you a recap of the introductory lesson on epidemiology in reference to the book that was published by Centers for Disease Control that was provided by Cambridge University de London. I will highlight the main points or topics that I think are most relevant and useful for anyone who wants to learn more about this core science of public health. So, what is epidemiology? If we split this word into parts, epi, which is a Greek word, means on or upon, demos means people, and logos means study of. Thus, epidemiology is the study of the distribution and determinants of health-related states or events in a specified population, such as demographic characteristics, environmental exposure, or other health-related factors. And it's also the application of this study to the control of health problems as defined by CDC. So we can then work around this definition. We can infer that studying epidemiology, we are looking for patterns of diseases or health-related events, either by person, place, or time. Under descriptive study, we seek to answer who, where, and when is a population affected. Epidemiology also uses some statistical tool such as chi-square to determine the relationship of these determinants or risk factors to disease or events at a certain population. In other words, it answers how and why the population is at risk, which is part of the analytical studies, while descriptive study focuses on generating inferences. Analytic study, on the other hand, concentrates on testing hypotheses, such as the case in experimental studies, cohort study, and case-control study. As a side note, it is relatively important to understand that epidemiology evolves over the years. Epidemiology may now deal with determinants such as genetic information, where I think genomics may have a big role to play. And also, it does not only deal with communicable diseases, but as well as non-communicable illnesses, injuries, or other health-related problems. Now, let's talk about epidemiologies. These are the people involved in this undertaking, and they are the ones involved in applying the knowledge concerning the distribution and cause and effect of a disease condition or event at a specified population. While clinicians diagnose and treat individual patients, epidemiologies, on the other hand, diagnose and treat the community. With regard to this, they conduct surveillance and communicate their findings and recommendations to other health sectors or health agencies. They also have a deeper understanding of the transmission of infections or infectious diseases, whether it's an outbreak, epidemic, or pandemic. Their main goal is to break the link between the host, which is the one that harbors the disease, the agent, which is the culprit of health problem, and the environment that allows the transmission of the disease, as you can see in the epidemiologic diagram. Furthermore, epidemiologies do not work alone. They come up with case definitions during pandemic or epidemic in collaboration with health departments such as World Health Organization and CDC. As disease can be unpredictable and can change its course, epidemiologies act accordingly to find a solution using previous evidence-based research or even using laboratory findings to help with their investigation. Consequently, they relay their field investigative results or surveillance data to help policymakers who formulate public health interventions or recommendations that are made available to the public. Unknowingly, we often practice these interventions just like wearing masks during pandemic or climbing the stairs to improve cardiovascular health. In essence, epidemiology is a valuable tool to determine health outcomes through data collection and characterization of diseases of health events by time, place, and person, identifying cause and effect relationship between variables that may affect the incidence or prevalence of a disease and other health-related problems. It is also the application of epidemiological knowledge towards understanding the health of the population while providing public health interventions in preventing diseases and promoting health. Thank you very much and have a great day.